can you get a fungus infection in your sinuses? The short answer is yes. Fungus thrives in warm, damp environments, and the nose and sinuses certainly qualifies for that. So there are three main categories. The first is called allergic fungal sinusitis. This is when you have chronic sinusitis related to a true allergy response from fungus that you're breathing into the nose and sinuses. So it's a true histamine response. You have chronic sinusitis in all of your sinuses and usually nasal polyps. There are classic CT scan findings on this that leads to the diagnosis, and treatment is surgery. So you have all of your sinuses opened up, remove the polyps, rinse out the fungal infection, and patients do very well. Antifungus medicines don't work very well for this condition. It really requires surgery. The second category is called a mycetoma or a fungal ball. It's a fancy word for fungal ball. Instead of having chronic sinusitis everywhere, patients usually have it isolated to one sinus, most commonly their cheek sinuses or maxillary sinuses. So surgery is opening up that sinus, rinsing out the fungal infection, and again, patients do very well. The third category is the most dangerous. It's essentially an ENT emergency, and this is called invasive fungal sinusitis. It only happens in patients who have compromised immune systems. So they have out of control diabetes in a state called diabetic ketoacidosis, or they're on chemotherapy, or some other condition that drops down their immune system. This fungus species invades blood vessels and kills off the tissue. So it requires emergency surgery to remove all the dead tissue, remove the fungus infection, and these patients do get treated with IV antifungal medicines and trying to reverse that underlying condition of their immune